Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Before our program begins, I would like to remind all of you to ensure that your mic is muted, except during the Q&A session, and if possible, turn on your camera throughout the program. And if doing so, please download the virtual background that is provided in the chat box. As a reminder, don't forget to fill in the attendance and feedback form later on. I would also like to remind all of you that we will be having a photography session at the end of this talk. And first and foremost, I would like to thank all of you for spending this morning with us today. Now we will officially begin our long-awaited event. This is a great pleasure for me to welcome all of you to this event. Praise to Allah Subhanahu wa Ta'ala for our health that we are able to gather for this program. We highly appreciate your presence in attending this event. Okay, so I am your MC for today, Muhammad Irfan Hakim bin Amri. Some of you would know me as Irfan Tony, and pleasure to meet all of you. In order to get his blessings this morning, I would like to invite Brother Bukhari for dua recitation. Please welcome.
Al-Fatiha. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وأصحابه أجمعين اللهم اغفر لنا ذنوبنا ولوالدينا وارحمهم كما ربونا صغارا. O Allah, Lord of the universe, in conjunction with the organization of Women One Industry Talk Series 14.0, Reality Talk with a Junior Medical Officer, today we raise our hands to you to ask for permission, mercy and blessings, as well as the guidance of the Quran, which you have always preserved under the greatness and your majesty. We ask you to be given the right path in all matters of life, for happiness in this world and in the hereafter. Allahumma yassir lana umurana wa la tu'assirha. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azaban nar. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wa barik wa sallim. Walhamdulillahi rabbil alamin.
Amin, amin, ya Rabbal Alamin. Thank you, Brother Bukhari, for the dua. May Allah bless this morning's knowledge sharing session to go on without any interruptions or obstacles, inshallah. So before we begin, I would like to make an announcement regarding our second speaker, Dr. Abdul Halim. Unfortunately, this morning he got an upper respiratory tract infection, URTI. So he's having a bad sore throat and thus won't be able to join us for today. Let us together pray for his fast recovery. Afraid not, we will have our main guest, Dr. Nurazlina binti Azizi. So let me briefly introduce you to a bit of about her background. She is currently working at the Obstetrics and Gynaecology in Hospital Tunku, Azizah, Kuala Lumpur as a medical officer. And she graduated from Kuala of Medicine in 2017, roughly around 5 years ago. And she was the vice president of Ikram Siswa UIA Kuantan, which is now known as Belia Harmony, and is actively involved in Pertubuhan Ikram Malaysia. She also volunteers in iBantu and Hidayah Center Foundation. We are very thankful and appreciate Dr. Nurazlina and as well as Dr. Halim for their willingness for accepting this invitation and giving us an opportunity to learn from their experience. But fortunately, Dr. Abdul Halim won't be here with us today. Thus, I feel delighted to have an amazing speaker for today's sharing session. And now, let's have One Industry Talk Series 14.0 Reality Talk of a Junior Medical Officer. Now, let's spill the tea. Before that, a kind reminder for all, feel free to flood the chat box with any question during the talk or during Q&A session after the talk. Okay, now get ready to be mesmerized, ladies and gentlemen. Give it up for today's special guest, Dr. Nurazlina. The floor is yours.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Can you guys hear me?
Yes.
We can hear you.
Give me some time to share my slides. Sorry. Alamak, okay. So, okay, can you guys see my slide?
Yes, clear.
Yes, okay. So, a bit of introduction of myself. So, my name is Nurazlina binti Azizi. You can call me Kak Lina, Kak Azlina, Kak Lina. I graduated from IIUM Kuliah of Medicine in 2018. In 2009, I joined Darul Quran for 1.5 years, and then I joined CFS IIUM for my foundation study for 1 year. Then I come into Kuliah of Medicine basically in 2012 till 2017, sorry. And I started my housemanship from 2018 April till April 2020. Okay, so basically there's about 6 years of studying and then joining housemanship as 2 years, and now currently I'm second year MO in Obstetrics and Gynaecology ONG department in Hospital Tunku Azizah, Hospital Kuala Lumpur. Okay, so basically I think we have a sharing session on what is actually the reality of our profession, basically our medical fraternity pertaining to us as a junior medical officer, house officer, and I think this will benefit the students a lot. Okay, so basically this is the outline of my presentation. I will share a bit about housemanship. What is exactly housemanship? What is the sweetness? What is the bitter things, bitter reality, and how can we make the housemanship better? And then a bit on what's next after housemanship. Basically, what can we do after that? Whether you want to stay in KKM, exit KKM, a bit of sharing on this issue of contract medical officer, and then I will end up the session with a conclusion and also Q&A session. Along the line, if you want to ask anything, then you can just freely join and ask around. Okay, so basically this is our kuliah, and I think every year we will have this photography session. Basically in Dataran Kong, this is after our oath taking ceremony in 2017, and I think every batch they will have their own photography, right? And Prof Jamal is the one who took the photo with his drone, and now I think he's the dean of KOM, right? Okay, so a bit of housemanship. So I started my housemanship in April 2018 in Hospital Kuala Lumpur and completed it 2 years after that in April 2020. So initially, when you're starting your housemanship, are you thinking of housemanship, thinking of finishing your study? So what actually do you think? You're excited because finally I'm earning something, or become scared, or you think, oh, can I really do it? You will hear a lot of negative things about housemanship, the tiredness, the bullying, the never-ending working hours. So what else do you hear about housemanship before? Do you want to share? What do you think about housemanship? Or you just think that, yeah, I want to pass my final professional exam, I want to become a doctor. So what do you guys think now? Have you ever thought about your housemanship, how it will be? Or just thinking, maybe I finish my study, I finish my final professional exam, and after this, I'll think about that. I don't know. But, hmm?
Yeah, we're
Anyone
all
want to
looking
share?
forward to going to the housemanship part, but we know
Yeah, looking forward.
what's waiting for us.
What?
We know what's waiting
Hmm.
for us. The bullying, you know,
Yeah.
everything is difficult. Yeah.
I think that actually the best moment in your life is actually when you pass the final professional exam. That is the pinnacle of your life, and you think that oh, that's the best thing, and that's the time when you really master your knowledge because you will learn hard before that, and then you pass the exam and you think, wow, I'm finally a doctor. Then you started your housemanship and things will change now. But overall, housemanship is a nice thing actually. So with the sharing of my housemanship journey, so I started my first posting in medical posting. This is my ward 23, that is our medical ward in HKL. We have a lot of medical ward in HKL. So one of it is ward 23. It's actually like pasar malam with patients everywhere in the corridor. Everywhere is patients and a lot of admissions, lot of discharge. And every day, although I should go back by 5, usually I can go back at 7, go back at 8, settling the discharge summary. And mind you, HKL is manual and you need to write everything inside the notes and so the letters. Okay, so the one in the blue shirt is actually my MO in medical ward. And surprisingly, I know him actually from a medical student because he is a houseman in hospital Tunku Afzan. And we are having our clinical there before we have SASMEC. So basically, he is the one who teach us how to insert lines, how blood taking, venipuncture. So when I saw him, like, oh, okay, I know him. And he also actually noticed me. So this is my medical posting. For 4 months, quite horror, but it ends up beautifully. Mm. Then come back to the next picture. My second posting is in ONG. And then ONG is a lot of emergencies, a lot of shouting. But actually, I enjoyed ONG the most. And I decided to take ONG after I finished my ONG posting. Okay, then the next picture, the one is Striker. Striker is actually a company for an implant for orthopedic. So this is our visit to the company. We have a dinner there. It's a nice posting. Then my fourth posting is pediatric. Actually, this is makan-makan during first Shawwal of the year. Obviously, no raya, but we have a good jamuan raya with the sisters. They are doing their masak rendang, and actually it's a nice experience. Then after that is my fifth posting, surgical posting. So surgical posting volunteer a lot. KL being October. Surgical posting in HKL is a bit scary. There are days that we need to come as early as 5:30 a.m. to review patient. Hmm. Because they have a grand round, consultant rounds. But yeah, we survive it. And my last posting is actually in clinic kesihatan. So for now, housemanship, you will have a total of 6 postings in a span of 2 years. So 4 months for every posting. So for your last or either your 5th or your 6th posting here, in emergency department, NS, also or clinic kesihatan, and the last one is psychiatric. So you can choose between these 4 postings, and also it depends on the availability. Okay. So for my housemanship, actually, I'm so grateful that I have a very supportive colleague and a supportive. Actually, from my batch, when I first started my housemanship, we have 4 of us. So during our lapor diri is on the 20th of April in HKL. So we took a picture together, and this is after we completed our housemanship. So this is all my IIUM friends. So we have my batch name is we are the 16 batch of KOM. So my batch name is M16. So we create a group on 16th of April, the 5 of us. Initially 4, but then Suwai came back a bit later, came in a bit later. So we have our group named 5 Ketul. So this is the group where we share, we find strength on each other, we gossip a lot, and basically we help each other a lot. So what I want to emphasize here, housemanship can be very sort of devastating, but actually having a good friends, having a good company will make a lot of difference. And I really thank for all my M16 punya kawan-kawan who helped me a lot during this journey. Basically, when you have friends macam ni, is an important thing because we all started with different posting. So we share the story. Oh, this specialist is like this MO is like this posting is like this. So actually, we learn a lot from each other. And this is my friend from the same intake. We finish our MO-ship together. This is the day before we lapor diri as floating medical officer. So these people really helpful, okay? So basically inside of a housemaid. So basically those who are in clinical years, from your observation, what do you think? You're looking at the housemen in HTAA. So what do you think their work like? What in your mind about what actually housemen work as? What is the work of houseman? What is the job scope of houseman?
Ward rounds,
What rounds lagi?
sending specimens to certain places, being
Yeah, actually
scolded all the time.
being scolded all the time. Oh, you're so sedih. Okay, actually sending specimen shouldn't be houseman work. It should be the PPK work or somebody else's work. But yeah, when your MO want it stat, then it become your work. Kerja tambahan lagi. As you observe when you do your work, what do you think? What jobs of housemen? Presenting during rounds, yes. Updating the progress of patient, yes. Then taking blood, lagi. What do you think from your observation?
Being the punching bag of the overstressed medical officer.
Oh yeah, betul lah tu. Being a punching bag of medical stress, on-call medical officer, so tired. So houseman lah jadi mangsa. Lagi? From your observation. So basically, houseman is the one who run the ward, or is basically the frontliner who run the ward. So basically in my department, for example, houseman is the one who is in the ward 24 hours, and the main job is actually to look for the patient, to really know and understand the patient, and then to refer a case to other team. Okay, this is the most common thing that you need to do. Even my first task as a houseman, I still remember that I need to refer a case to Oftal. Okay, and then the second picture, commit. What do you understand for this? Please give me the appointment. There is another task of houseman. You really hate it, but you need to do. It's actually go down to the radiologist and requesting for a scan. Either it's a ultrasound, urgent ultrasound, or urgent CT scan, urgent MRI. Your bosses expect you to get the appointment today, now and now. And then you need to go there, you need to present the case, and you need to really make it convincing for the radiologist to give the appointment. If you didn't get it, you will come back with a scolding. Okay? So this is basically the task of a housemaid. Okay, so actually, when I started my housemanship, my medical officer shared to me. He said that when you see a patient, you should think like a MO, meaning that how can you better manage this patient? So this is actually what you should be in mind. Okay, and then tapi actually the reality is you think hard lah, as long as you don't get scolded today. So that's basically the motto of everyone lah. So putting all this together, so actually how to make your life as a housemaid is a more bearable life. Okay? So actually it starts with your attitude. Attitude is very important. You can be. Okay, we didn't expect you to know everything. For example, like now in ONG, we didn't expect you to handle obstetric emergencies. We didn't expect you to handle a maternal collapse. We didn't expect you to handle a cord prolapse. But what we want you to know is, what we want you to actually participate is, for example, like when we have a maternal collapse, we want you to be able to show the attitude that you want to learn and attending the patient, be there, trying hard to learn. It's okay to not know something, but it's not okay to pretend that you know the things and show a bad attitude. That's not okay. Okay? So the most important thing is your attitude. So this you need to train from your early days as a medical student. Sometimes because we think, because most of us is the top scorer in the school, and then we go to CFS, we think that we did well. But actually when you start your housemanship, it really a challenge to your ego. Okay? And next thing, you need to do a lot of things. If you see the houseman running around the ward, you need to clock a new case, you need to take a blood. Some bloods are urgent, some bloods are more routine. And then you need to refer. Some referrals are urgent, some referrals are routine, meaning that you can do a bit later. And then the patient, the family members, the nurses will bug you, "Doktor, bila boleh discharge? Bila boleh discharge?" But oh my God, all the discharge summary, referral letter, semua tak siap lagi. Then you will be, you will be stressed. Okay? And on top of that, people expect you to be running around. Your MO will expect you to be there 24 hours to help her. So a lot of things that you need to do. So the most important is you must make it organized. You must plan how your life, macam from now on, you must be organized. And when you participate, for example, all the clinical students, when you participate in a ward round, you see what is the command from the specialist. See macam, okay, what blood needs to be taken from this patient, what another blood, and you see and you try to actually organize which scan to request first, which referral to be done first, which one you can delay a bit. So that needs some thinking. Okay, and then be proactive and think ahead. So from now on, you must try to be proactive, especially during your bedside teaching. During your bedside teaching kan? The name is bedside teaching kan? When we yang teaching, the clinical teaching. I think it's bedside teaching. Be proactive. So don't stand there and just listen, but be proactive lah. Meaning that you need to read before and you need to try to discuss, try to argue why did this case be managed like this. So, for example, when I'm a student, I used to kacau the houseman and ask them, why this thing is like this? Just help them and try to ask them. Okay, be proactive at our houseman. And what I student, I remember, I think most of you guys pun akan buat benda yang sama kot. To learn how to take coming morning blood. Just work among ourselves to insert the branula, to take the blood, and because we help them. Because kalau tak dapat, then they will. But from the student days lagi, you kena, boleh dengar ke hilang-hilang? Hello?
Hello.
You guys?
Putus-putus.
Apa dia? Boleh dengar ke hilang-hilang?
Putus-putus.
Putus-putus I don't know lah.
Boleh.
Better Actually I kat hospital. I just finished my on-call yesterday. My yesterday punya on-call 24 hours. And then baru finish my rounds. So dekat hospital lah. So hospital ni punya line, although ni direct line dengan phone pun dia tak ada berapa bagus lah walaupun dekat HKL, tengah-tengah HKL. Okay, tapi kalau you tak dengar, then you just interrupt and bagi tahu you tak dengar. Okay? So I think the blood taking, all of the things mostly we learn during our posting in HTAA lah as a student. Except PITS. PITS kita tolong pegang je lah. Tapi most of other blood taking, memang we learn it from our student days. Insert CBD, that is all we learn during our student days. But you need to be proactive. Okay? Because yes, we have a logbook when we are a student. And yes, sometimes we can just sign our logbook blindly, kan? Nobody knows. Yeah, but dia jujur lah because because the skills tu, kalau you tak buat, you memang tak dapat lah. Okay? Be proactive and think ahead. Think ahead ni, especially when become housemate, you need to think how your MO think. So bila so that you can offer things. Contohnya when you have for example for example, you know that your MO want to do a lumbar puncture or want to do tapping, for example. So you must think ahead and prepare the set, siap-siap, prepare the forms, get the bottle for lumbar puncture, for example. So that is the way how you want to be a good houseman lah. Multitask but prioritize. That is where I think, because as a house, everything, everyone will, especially for example, like now I'm in ONG, in labor room. So everyone will call you. Your MO will call you. Houseman, mana houseman ONG? Your MO will call you. And then nurses will call you. Doktor, postnatal ni dapat belum? Doktor. Everywhere will call you. Doktor nak line. And then everyone will literally call you around. And you may be just 1%, 2% running the whole labor room. So you must be able to multitask and prioritize your list. And a bit of sharing now, I think there's a lot of vacancy in houseman punya place, because I think after our batch is, now you guys punya batch berapa orang? My batch is about 150%. Now your batch 100 plus
146.
Yeah, a lot juga 146. But somehow when they open the e-houseman, there's a lot of vacancies because the intake of housemen the intake of housemen is a small number, but they have a lot of vacancies because most of the hospital, the current issue now is tak cukup housemen. So for example, like the ward, if biasa-biasa 2 to 3 person jaga per ward, maybe left with 1 person. So you must really be able to multitask. I think nowadays, because they send less people to oversee to do medic. So that's why we have some form of shortage of housemen. Okay? Plus, there are people who like to EL, people who like to MC, and you just need to be patient with them. So you must be able to work. You work smart lah, basically. Okay? Don't be afraid to ask or seek for help, especially when something you think is not right. Then you need to reach out, because you are the one who will first respond to the patient, because you are the one who running around with the patient. Your MO maybe in OT, your MO maybe in the clinic, or your MO maybe tengah makan, but you are the one with the patient. So whenever the patient says something, sakit dada, I cannot breathe, it's all they will talk to you, or they will talk to the nurse, and the nurse will inform you. So you need to be able to seek for help. Cannot be afraid. You cannot just senyap. So this you must develop from your student, yes. And then of course, I never stop learning, and you must be happy and just relax. Okay? So any other question that you want to ask? Can you excuse me for a minute? I have a phone call nak answer kejap Hello? You guys can take a break and have the phone call and answer. Kejap, sorry. Okay. Come back. Sorry for the interruption. Who's call biasalah. You cannot, macam itulah. You cannot simply tak jawab phone. Maybe people is asking about your management. Okay, sorry. So, never stop learning. Be happy and just relax. So basically, any other question before we, any other question that you want to ask?
Ada several questions yang masuk lah.
Mai.
Okay,
Come.
so
Santai lah. What do you want to ask?
the first one is about medical card plan. Do you know about medical card plan? What do I get from medical card plan? Can my medical card plan cover all illness and accidental injuries?
Medical card plan
Yeah.
Medical card plan basically it's a form of insurance. If you're going to private fraternity, private hospital, then medical card plan is something important lah, because some of it covers some kind of illness. But buying a medical card, then you need to look at what actually the consensus before, perjanjian before that. What did the medical card cover? What kind of illness? Not all illness covered by the medical insurance. So it's important if you want to seek treatment in private punya setting, but in government setting, medical card didn't really play a role lah. Because in government setting, most of the treatment is you need to pay, but very, very like macam admission is only RM1, clinic pakar is only RM5. But even for private, then medical insurance is something that you may want to consider. That's really the medical card, huh? Any other question? Yeah, from the chat box.
Yes. I read the question. The question is, as a houseman, how do you cope with patients that tend to throw tantrum, like elderly or children? Is it actually the major source of stress?
Oh, okay. Tantrum, patient tantrum. So actually, when you're dealing with patient, communication is very important, because you need to communicate well with your patient, but sometimes they didn't really understand what happened to them, or they just don't care about themselves. But regardless of how bad is the patient treating you, you need to calm and treat the patient well. Because if you are not treating them well, then you can get all sorts of complaints, and the life will be very messy after that. So you just need to fake it, just senyum-senyum, and just try to reason with the patient, talk properly. But if the situation you can't handle, then you need to escalate the matter to your supervisor, basically to your medical officer. Same when you are a medical officer, when you can't handle that, you need to expedite to your specialist and to your consultant. We can't really handle everything by ourselves. You certainly cannot be a hero, but you need to learn the counseling, how to counsel. And I think they taught us well when we are in 4th year, when we are in family medicine punya posting, then they taught you well lah. But you really need to, you know your limit. Basically, as a houseman, when you are dealing with different difficult patient, you must know your limit, and you must involve some higher personnel, like your medical officer and everything. Because if thing went wrong, and your life will be messy lah. Okay? And there's the other important thing about houseman or medical student in the ward. You need to know your limit. To what extent you can do, to what extent you must involve other person. And that you will learn along the way. Okay? Any other question before we move on?
Okay, the last question. This question actually comes from me.
Okay.
Since basic medical sciences only involves memorizing facts, I noticed that there's a lack of leadership and critical thinking skills among the students. Has this ever happened to your batch?
What do you mean, sorry? Lack of clinical thinking skills.
Lack of critical thinking.
Critical thinking. Okay, actually, what's the most important thing to learn during your 2 years of BMS? 2 years of basic medical sciences. Basic medical sciences actually provide a platform for you to understand your clinical ground. So basically, you learn about the pathology of myocardial infarction, for example. What causing that, how the pathology, you punya buku apa, Robin, Mama Robin, Papa Robin, ni. Then you learn about the pathology of myocardial infarction. You learn about wound healing. You learn about all the histology. When you're so dry and you rasa macam, this is just memorizing. And then your exam your long note short note, and then your essay, and so you rasa macam is all about memorizing. But trust me, this actually build your foundation even for your clinical years. So when you see a true myocardial infarction, and when you learn about the management of myocardial infarction, they will somehow relate back to your basic medical sciences actually. So what is the pathophysiology of myocardial infarction, the drugs, what is the pharmacokinetic of the drugs, how the drug works. It really will come back to your basic medical sciences. And you know how important your BMS is when you want to pursue for your when you want to pursue for your for your specialist training. Okay, when you want to pursue for your specialist training, regardless of you nak jadi anesthetist ke, you nak jadi ONG specialist ke, you nak jadi you nak jadi physician ke, surgeon ke, your first year of training is back to basic medical sciences. And for example, like your entrance exam, you will learn back about your anatomy, you will learn back about your physiology, pharmacology. It's the same thing that you learn during your first and second year medical student. And you know, I still keep all my notes that I did, and all the slides that we have during our first 2 years of medical student, because it helps me to study for my specialist training. For example, like in ONG, kalau you ambil a parallel pathway, I'll touch a bit on parallel pathway. Kalau you ambil parallel pathway, then you have MRCOG part 1, MRCOG part 2, and part 3. Part 1 is solely your basic medical sciences. You learn back about your anatomy, the question will be on anatomy, pharmacology, physiology, and embryology, everything they will ask you back. So I literally use my notes back from my medical student days to help me relearn about the basic medical sciences. So that's the important, actually builds your foundation. So when you think that it lacks a critical thinking, I think actually the department is helping that by the PBL session. But maybe because it just started, so you rasa macam you cannot really relate with the clinical things. But trust me, your first 2 years is important, and you simpan all your first 2 years notes, and all, especially your own notes lah, your anatomy notes, because it might be useful when you are doing your master for your specialization later. So don't disregard your first 2 years of you punya ni, of you punya training lah. Okay? So I think we move on. So now most of you are student, right? Your first year, second year, and then your clinical years, third, fourth, fifth year. So actually, I'm really thankful for my lecturers lah who actually built me up so that when I started my housemanship, it's not that bad. Okay, because I think most of our lecturers are still garang-garang. Dr. Naim, is it around lagi? I think Dr. Naim is still in IIUM, kan? Dr. Naim, ni, internal medicine. Aku tak sure lah who is around, who is not around. Prof. Hamizah in ONG. So, basically, the most important thing is you need to participate during your ward work session. So, kan every day when we are in clinical years, the classes are there, but you are expected to be in the hospital from 8 to 5 for your daily ward work, right? In the jadual, memang in the timetable, they will say there is still ward work punya session, kan? So, you're expected to be there. So, you must participate in your ward work. Okay? For example, when you are placed in the clinic. So, when you are placed in the clinic, now, student, korang still rotate kat klinik ke? Ke mostly kat korang ni, just basic science, basic medical sciences and clinical, yes. Are you guys still rotate dekat klinik? Tak sure how.
Diorang dekat Susmed, HDA.
Susmed ada masuk klinik ke?
Ada.
Okay. Tak apa. Those yang dekat klinik, yang attached dekat klinik, you need to participate. You just jangan duduk situ, diam je. You must be there and talk with the MO yang you attach. Ask him, try to palpate the abdomen. Try to make yourself nampak eager nak learn so that the MO are forced to teach you. Kalau tak, diorang akan senyap je kat situ. And diorang tak layan pun you as a student. That is what I think lacking lah when I'm now in HTA. When I see medical student in the clinic, I rasa macam, they are just standing there waiting for chop, and that really make you become irritable lah. And my specialist once memang jerit to the medical student because just standing there and asking for chop. So I think to be fair, you guys need to participate in the clinic. Ask around, can I palpate, like you have a bridge presentation, can I palpate when you have a twin pregnancy? Can I palpate and feel the twin? So you need to ask around. Kalau you senyap je, orang pun akan senyap jugalah. Okay? That is when you are in clinic. When you are in the ward, so you ask around, can I help take the blood? Can you teach me how to do a venipuncture? Can you teach me how to insert a branula? What is this? And you see around, this is green branula, this is pink branula. What is the differences? This is a blue branula. So what is the differences? Is it just a color or the size is different? Ask around. Okay? CBD, you have a lot of size. So learn which one is white, and how to insert the CBD for male, how to insert CBD for woman. Okay? So that when you are a housewife, you know how to do it. And that is one of the advantage of a local graduate, where usually the local graduate didn't have a lot of problem to assimilate into the working punya condition, because they should be able to understand. Except that nowadays the new generation of housemen yang COVID punya generation, so they are a bit macam difficult to start working, because I think waktu COVID mostly is online punya lecture kan, so it's a bit difficult lah. Tapi now no more COVID, then you need to participate really in your work. Okay, in OT, learn, see how. I think when we are in ortho back then, they give us the chance to scrub in, right? Kan now dah tak sure now how, but dulu we can scrub in. So we learn how to scrub, we learn how to close the skin, we learn how to do interrupted suture, and in ONG we learn how to conduct delivery, we learn how to suture. So a lot of things that we can learn before we become a houseman. Okay. And then master the art of presentation. So believe it or not, 50%, 60% of your work as a doctor is actually talking. You talk to your patient, you talk to your colleague, you talk to your nurses, you talk to your PPK. It's actually how you present yourself. When you see around, following what round in the ward. So you see most of the time, actually they are presenting. The MO is presenting to the specialist. The houseman is presenting to the specialist. So it's actually how you want to present. And when you are in clinical years or in your basic medical sciences training, we have a lot of presentation to do. We have apa tu? Apa yang apa tu? PBL kan, problem based learning, that you need to talk. A lot of talking and talking, because yes, most of the thing in medical, the most important is presentation. Okay, so you must know how to present, learn how to present, especially during your bedside teaching. And I remember Prof. Kamara Bahya, is she still taking your ONG punya class? So most of you not in clinical, tak sure lah. So Prof. Kamara Bahya dulu memang really teach us how to present paperless, so that we know how to present paperless. So I really thankful for all the training that they give me lah. Okay. Master the art of multitasking. Multitasking is very important. So from your student years, like, involved in all these co-curricular activities. Your MSc punya program, you punya whatever program that you have, you punya sports. Do all this sort of thing. Don't just study, because you need to be able to multitask in your life. So kalau you student, you kerja, you go study, tak buat anything else, then you tak biasa nak multitask. So be involved in other things besides study juga, the other things yang beneficial. For example, like flood relief, kan orang expect Kuantan will be, Pahang will be affected badly this year. So go and join all this flood relief program. Know your community. Okay, it will help you a lot. Know your emergencies. Must be able to, at least if you grab your emergencies, you know what is emergency, what is not emergency, you know what to pick up. You know to read even the basic, you know what is abnormal BP, how to react on high BP, how to react when patient desat, when patient collapse, when to CPR, how to CPR. You must know your emergency, okay? And then you must be happy and enjoy your student life. Just enjoy your life. Jangan stress pada student. A lot of people who quit, dia stress dengan student. Tak nampak slide Aku tak tahu.
Yeah, you stop presenting.
Alamak, sorry lah. Stop presenting Tak perasan lah. Mungkin waktu I angkat call tadi kan. Okay. Entahlah. Basically, this is the thing lah. Okay. And I ada question tanya about taking leave during housemanship
Yes.
Ah.
Senang ke nak dapat MC?
Senang ke nak dapat MC? Susah lah nak dapat MC. So actually, per posting, you are given how many Per posting, you are given, I tak ingat lah how many days. Ada siapa-siapa ingat tak? I rasa what? 7 days of leave and 7 days 14. Alah, lebih kurang lah. Per posting have 7 days of leave. Then you kena leave within that 7 days lah. Cerita pasal your housemanship punya jadual kerja is basically depends on hospital. Basically, you have to work 6 days per week. So, you have to work 6 days per week, and your off day can be any days on the 6 days. Meaning that your off day not necessarily be Saturday, not necessarily be a Sunday. So you're off maybe on Wednesday. So that is punya jadual kerja lah. Okay. And a total of 80 hours per week you need to work. So you can adjust macam tu. And that is your working days. So if you want to ask leave for vacation, so it must be, and per posting, every 4 months you are granted 7 days of leave. So you kena actually susun your leave lah. So that coverage is okay and you can have your leave. Macam tu. And it depends on approval juga. Not necessarily you want a leave and it is approved. Okay? Tapi actually you can susun your life sebab for example you have post call off, you have post night off. For in certain hospital you punya kerja is like from 7 AM to 7 PM one shift, and then 7 PM to 7 AM one shift, so about 12 hours shift. So sometimes after you buat shift malam, tomorrow tu you dapat post night off. Then maksudnya pagi tu you tak payah kerja. You boleh post night off lah. The next day tu you post night off. So the next day tu you kerja balik. So you boleh susun lah kalau you nak cuti lama. So maybe the first day tu yang you nak cuti tu is your post night off. The second day tu is your off day. The third day tu is your leave. And then the fourth day tu mungkin kerja malam. So you dapat lah buat 3 days plus. So actually it's not that bad lah. You can manage your time. Okay. So so basically that is, tapi depends. Ada certain juga yang amalkan 3 shift system. So kalau 3 shift system, basically you masuk kerja pukul 7, then until 5 PM there's one shift. Pukul 7 till 10 PM one shift. Pukul 7 till 5 PM, this is about a weird shift juga. Till 5 PM, then they give you 5 hours off. And then you masuk balik pukul 10, you kerja balik sampai esok pukul 12 tengah hari. Ada jugalah shift macam tu. It depends on your department. So tak payah fikir banyak sekarang. Tapi actually you can enjoy your life. You can still go vacation. You boleh susun your life. So it's not really that bad lah. Okay. SMO, lagi susah lah. You nak cuti pun quite susah. Okay. So a bit of sharing of waktu I student. So actively involved in other things besides medical. So I train my juniors for debat. So every other week I'm coming back to KL to train them. So they menang lah a few kejohanan. So it's nice things, actually escapism from the stress. They are actually my happy pills. So they actually keep me sane. So what I want to actually emphasize is you need to do something else juga to keep you sane. Kalau tak, you will become stressful. Fikir pasal kerja, your patient kerja, your patient kerja, patient exam. Lepas tu mini test, after mini test, clinical exam, pass fail. It's very stress. So you need to have something else. So go and find your something else tu apa. My friend go lepak-lepak Teluk Cempedak for no reason overnight. Some go naik bukit, Pelindung lah, or sort of bukit dekat Kuantan, or sort of air terjun. But you need to enjoy your life. Do something else. Involve in all those volunteerism. Involve in everything, something else that keep you sane. Okay, this is my take home message lah. And this is my involvement juga lah. Involvement with Ikram Siswa at that time. So a lot of volunteerism things, Rohingya punya things lah. Macam we do a lot of things, especially as a student lah, you have a lot of time. So that will develop you punya communication skill, that will develop your multitasking punya skill, and that will keep you sane. Okay, so that's important. So what else you want to ask about housemanship? Housemanship before we go and sentuh about what's next after housemanship lah. So kalau you nak tanya okay tak houseman? I will answer is yes, I enjoy my housemanship. But at the same time, kalau nak tanya nak ulang lagi tak? Jawapan dia tak lah. Cukuplah sekali. Dan if lah, kalau orang tanya, did I enjoy it? Yes, I enjoy. Other times, yang sangat happy, ada times yang sangat sedih. Overall, I enjoy it. Tapi kalau tanya nak ulang balik as a houseman, memang tak lah. Okay. So kalau janganlah macam you jadi houseman, tak makan. You kena susun your life lah so that you sempat makan. You sempat sembahyang. That's more important lah. Manage your time, manage your life well. Okay? What other thing you want to ask? And go and join all these preparatory course. You have all those preparatory course. Banyak team yang buat course before housemanship. Join all those courses lah. Okay? It will be beneficial sometimes. Tapi I believe kalau you IIUM graduates or you local graduates, tak payahlah pergi join all these course yang quite pricey, because I think kalau you betul-betul participate in your ward work, it will help with your clinical skills, it will help with the housemanship. So you can join, but UIA pun ada buat, I think, preparatory course for houseman. So do a lot lah waktu you punya houseman. Belajar how to CPR. I think I CPR a lot waktu I student. I CPR a lot because semua orang dah pernah nak CPR. Student je semangat nak CPR. So they will give aku CPR everyone. Macam itulah. So, apa lagi, ada apa-apa nak tanya ke sebelum kita share live after your punya housemanship? It's off my slide for a while. Ada nak tanya apa-apa?
There's no question.
From the floor, kalau nak tanya, you boleh tanya lah. Kalau tak, nanti kita tanya along the way lah. Okay? Ni masuk. Ya, apa? Kejap. Okay. So now sharing what's next after the housemanship. Okay, sorry, ada gangguan pula. So what's next after housemanship? So
Doktor, the slide.
Ada slide tak? Kita tak nampak Oh, tak nampak kot. Sorry lah. Kenapa lah tak ready? Okay, so what's next after housemanship? So after you grad, okay, you dah habis your professional exam, you dah go to your graduation, dah ambil scroll semua, then you fikir balik lah. Betul ke you nak jadi doktor ni? Kalau you betul-betul you nak jadi doktor, you want to continue working as a doctor, then you need doctor in Malaysia, then it's mandatory to complete the housemanship. There is no way to escape. So how horrible, how terrible, you dengar orang cerita macam-macam, you still need to complete the housemanship. Kalau you nak jadi a doctor in Malaysia. So you tak ada choice. So you can go and jump into the training. Okay? Tapi kalau you dah graduate and you think that you want to do something else, it's okay. Tapi please make sure that you have a good plan ahead. Okay? A lot of housemen resign for multiple reasons. Most of them is stress. And the stressor can be from the working environment, can be from the toxic culture in the department, can be from the family punya issue. So a lot of stress are there. Okay, so when you experience all this stress, okay, talking about stress in housemanship, kan? So you must be able to function well, because certain department, they really like macam mark you. A certain person punya personality, they will mark you. Kalau they think that you are not good enough, so orang akan mark you, this person not good enough. So you become stressed, you become jadi anxious, you become depressed. So when you have all this negative emotion, negative thought, don't malu nak jumpa you punya psychiatrist ke, psychologist ke, to help you with that. Okay, before the melarat and you become lagi teruk. Okay? Counselor, that's the word lah. Okay? But if you really want to quit, you must plan of what you want to do ahead. What business you want to join. You jangan quit macam-macam tu je. So you must plan. Because kalau my housemate cakap kat I kata she wanted to quit, then we'll ask lah what you want to do. Kalau jawapan dia tak ada nothing to do, then you will better complete your housemanship lah. Okay? Actually, kalau you fikir gaji as a housemaid is 4K plus. 4K plus tu actually a big money for someone who started working. And you must be grateful for that. Kalau you tengok your friend in engineering ke apa, most of them start dia punya life tu, you punya kerja tu about 1.5K, 2K tu pun susah nak dapat. So you must be grateful for your salary lah. Then kena kerja betul-betul lah. Okay? And then after you complete your housemanship, okay, finally 6 postings, I'm done with my housemanship. So you kena fikir, what's next? You want to stay in KKM? You nak exit KKM? Because now you know all of us, when you start housemanship is as a contract medical officer, a contract house officer, contract officer lah. So contract officer, they will give you initially 3 years. 3 years, maksudnya 2 years of housemanship plus 1 year of MO. So you then, that is the first 3 years of contract. So when they will renew 2 yearly. I think they will renew your contract 2 yearly until you got offered a permanent punya post. So not everyone will be offered a permanent punya post. You apply and then you go for interview. Then I don't know how they select, but they will select some to be absorbed as permanent and the rest will stay as contract. Okay, that is starting from 2016, if I'm not mistaken. Okay, so when you start the housemanship and when you start working, you kena fikir what is your end point. You want to stay kat KKM ke? You want to exit from KKM? And what you want to do. You cannot fikir like, oh, nanti, because time is running and time is chasing you. Okay? Kalau you nak fikir, I want to stay in KKM, then you need to think. You want to do clinical, you want to do non-clinical things, administrative punya work, public health, a lot of things that you can do, okay? And then you want to become a specialist, you want to go for specialization, and what kind of working that you want. When you're a houseman, yes, you have all this shift system, night, post-night, night shift macam-macam. But when you MO, you can choose lah department yang more decent working hours, macam apa, oftal, dermato. You may have on-call, but your on-call is not that bad. Pathology. Then you think about that, especially perempuan lah. When you kahwin kan, so you fikir what kind of working hours that you want. And then surgical versus non-surgical punya thing. If you want to go for a surgical punya thing, then better you decide early so that you can get your training early. If not, nanti, because you buy time, you know, bila you habis houseman, kalau you tak dapat department yang you nak, then it will be a lot macam time yang bukanlah wasted, but macam orang lain dah belajar lebih daripada you, so nanti you kena start balik. So you kena think wisely lah you nak buat apa. Ada setengah orang waktu dia student, okay, macam waktu I student, I tak rasa pun I akan go clinical. I mati-mati I will go non-clinical. I want to do basic medical sciences. I want to become a lecturer, all this thing lah. Tapi when I start my housemanship, suddenly oh okay lah, I buat clinical lah. So it can change. So you need to think lah. And you need to decide, especially waktu you dah start you punya houseman lah. So you kena fikir from there. Okay? Kalau nanti kita cerita a bit about specialization. If you don't think that you want to be in KKM, rasa okay lah KKM as a housemanship punya training, then you rasa you nak keluar and explore something else, you boleh je buat benda-benda tu. Habiskan your khidmat wajib, then you can go. Okay? Join the GP, Kementerian Pengajian Tinggi as a service MO in hospital university, you can go there. And such as lab. Putus-putus Apa tak tahu. Line. And then you can also join private lah, macam OSH. Putus-putus sikit. Ni salah kat internet kat HKL. Okay. Putus-putus ke? Okey ke tak?
Sekarang dah okey.
Putus-putus
Teruk
Ha?
lah internet HKL ni.
Apa dia? Terus internet HKL ni. Tak boleh nak bantu lah. Okay lah. And then you boleh join juga private macam OSH. Okey ke? Ke tak dengar?
Boleh.
How lah to make you dengar? Dengar ke tak?
Dengar.
Dengar. So you can join jugalah. Macam you can ambil OSH punya training. You ada private punya OSH. You can work in KKM punya OSH. OSH is actually korang punya public health tu. Korang punya apa tu? Family medicine and apa tu? Kita punya training tu tak ingat lah. Tapi occupational safety punya health. Kalau kita punya posting tu nama tak ingat lah, tak apalah. Public health lah kita panggil. Tak ingat lah. Tapi this is yang Dr. Razman punya specialty. So you can ambil the exam dekat NIOSH punya body and then you can go in the private certain ONG punya apa tu, oil and gas punya banyak company pun dah ada occupational safety health punya officer, or you can be in KKM punya lah. There's all your choices after. Tapi dia punya pokok pangkal ni you kena habis punya housemanship. You tak habis punya houseman, ni semua tak ada lah. Okay. Kalau you nak jadi specialist, then the few ways you can become a specialist. You ambil entrance exams, parallel pathway. You can ambil, kalau you nak aim for master dekat Malaysia, you can ambil MEDEX, Medical Specialist Pre-Entrance Exam. Setiap tahun ada 2 kali exam ke 3 kali exam. You bayar 800. You boleh attempt lah sesuka hati banyak kali sampai you pass the exam lah. Now MEDEX untuk most of the specialties memang ada dia punya entrance exam. Kalau you rasa you nak buat, you boleh buat MEDEX ni waktu you houseman. You even boleh buat waktu you habis you punya, maksudnya while waiting for housemanship pun you boleh buat. Kalau you rasa daripada sejak azali lagi you memang nak jadi ONG for example kan, you boleh je ambil punya MEDEX tu waktu you tunggu you punya housemanship, tak ada masalah. Janji you pass. Macam tu lah. You bayar 800, you boleh ambil the exam tu. Ada, most of the specialty ada. Oftal ada, peto ada, forensik ada. Macam tu lah. Cuma kalau you ambil MEDEX tu, dia ada 3 years of expiry date. So kalau you ambil MEDEX tu, dia laku 3 to 5 years kot. 3 to 5 years, I'm tak sure 3 years ke 5 years. Tapi you ambil exam tu, you kena baca dah dulu. So kalau after that, you tak ambil master within that years, dia akan expire, you kena ambil semula lah. Then MEDEX exam. Public health ada, family medicine ada, mostly ada lah. And I really advise you untuk ambil you punya, kalau you nak jadi specialist, untuk ambil waktu you still a houseman lah. Or you junior officer lah. Okay? Sebab lagi lambat MEDEX, most of the thing is you punya apa tu, basic medical sciences balik dia akan tanya. It's really basic medical sciences, and kalau you dah UIA, it should be a plus point. Sebab you dah biasa, kita dah biasa buat true false punya question. MEDEX is true false with negative marking. So kalau macam kita 5 sama je. 5 CDE lah, true false punya. Hilang macam mana ni? Hello, dengar ke?
Hello, dengar.
Dengar dengar je. Okay. So, that's about MEDEX lah. Kalau you fikir you nak go for parallel pathway. Parallel pathway ni maksudnya you ambil exam yang daripada luar punya body. Dia ambil exam daripada luar punya body. Okay. For example, you ambil daripada, contoh kalau ONG, you have MRCOG punya exam. Kalau you nak ambil medical, internal medicine, you have MRCP. PITS, MRCPCH. Psychiatric pun dia ada juga dia punya luar punya body. So basically this is all UK punya exam. You boleh ambil. Kalau for example MRCOG ONG, you have part 1 punya paper. And then you have part 2. Part 1 is basic medical sciences jugalah. So basic medical sciences you boleh ambil bila-bila. Dia tahan 7 tahun after you pass before you nak ambil second paper lah. You habis sampai part 3 you jadi specialist. So dia sendiri belajar, sendiri spend duit. Satu kali exam mungkin buat 4,000 sebenarnya you bayar dalam UK. Tu belum lagi lah dia masuk dia punya buku-buku lah, dia punya study group lah. So quite pricey, tapi you tak ada bond dengan, tak lah quite pricey lah, tapi you jadi specialist on your, maksudnya you on your own pace lah. Kalau Medex masuk master you masuk university. You masuk university back for 4 years. Then after 4 years you exam, then you pass your exam, you jadi specialist. Kalau you ambil parallel pathway, it's your own way. You suka hatilah you nak ambil bila examnya, until you become a specialist lah. So this is the options yang you boleh buat lah. A lot of orang, especially those yang tahu dia nak buat apa, akan ambil dah parallel exam ni buat to the houseman lagi. Macam me myself ambil my part 1 waktu habis ONG, sebab dah tahu macam nak buat ONG, terus register exam, study, and then by my 4th posting, I dah ambil the exam. Ada juga my friend yang memang ambil MRCS, MRCP daripada zaman the houseman lagi. So then by dia macam, bila dia habis housemanship tu dah ada some paper, dah ada some qualification lah. Those yang nak pergi buat klinik kesihatan family medicine, you have MIN-FM, you have DFM, so semua tu lah untuk all the exam lah yang boleh ambil. Okay, this is after you habis punya housemanship. Tapi something to think, waktu you still a houseman, kalau you boleh nak ambil exam. So trust me, waktu houseman you ada bagi banyak masa nak study daripada waktu you dah habis exam. Okay, daripada you dah habis houseman. Bila MO tu busy dia tak boleh buat bincang, so kurang masa untuk study. Next thing yang you can consider kalau you nak jadi specialist ke apa ke is publication. So publication pun somehow is important. I rasa waktu you 4th year, Prof Jamal akan cakap banyak on for publication. Even UIE pun dia ada dia punya own scientific punya conference where kalau you buat you punya elective posting, elective research, and then your research tu presentable. Rasa kita ada platform untuk present dekat Medical Research Symposium UIA. Every year ada. So you boleh present juga dekat situ. You talk with your punya lecturer, you punya supervisor lah. Tapi I highly recommend untuk those yang rasa nak jadi specialist, untuk start daripada you punya elective posting tu, go and take research and then learn how to do research. Learn how to present a paper, because it will add some weightage into you punya master punya interview. Especially untuk siapa yang rasa nak jadi general surgeon dia tak ada parallel pathway, MRCS tu tak recognize. So you tak nak you kena fight for master punya place yang very limited. Sama juga dengan orthopedic surgeon, you tak ada parallel pathway. So you kena fight for a limited place untuk specialization master. So I really recommend those yang nak go for that journey, untuk you belajar daripada you student how to write a paper and publish a research. Okay? So this is my contoh-contoh lah yang buat. This is waktu dah dekat ONG lah. Ni more like case presentation. Tapi waktu I student pun, waktu the elective research punya team, my team menang the best elective research tu, and we present juga dekat medical IIUM punya symposium. Research on CTEV with Mr. Shukrimi and Prof Nora. Okay. So from there you kena belajar siap-siap and think about your future lah. Kalau you rasa you nak join GP, then you kena equip yourself with skills and also you punya knowledge. You pergi all the courses, ultrasound course, you pergi all this bersunat punya course, estetik pun boleh. Go to all the courses so that you jadi GP yang berjaya and GP yang ada skills lah. Okay? Kalau tak, you macam nak resign masuk GP tapi tak ada preparation apa-apa, your life will be difficult lah. Sebab sekarang semua orang pun buat GP, so you need to find something else nak make yourself shine lah from others. Okay? So basically ni lah, commit yourself to lifelong learning. The most valuable asset you ever have is your mind and what you put into it. Saya selalu cakap kat my houseman, tolonglah jadi houseman yang berfikir. And tolonglah jadi houseman yang try memahami patient. Okay, kalau you daripada student pun, you tak try memahami patient, tak fikir, you just follow je. Then you follow je, you tak faham pun apa yang you buat. So bila you nak refer case to other department pun tak faham. You nak request imaging punya orang pun tak faham you cakap apa. So you pun tak faham you cakap apa. So you must understand lah, and you must be aware of your situation lah. Okay? And the end, I think, nowadays, yelah you nak jadi houseman ke, you nak kerja as a medical punya professional kat mana-mana, ni lah kita back to our basic lah, okay? Strengthen our akidah yang sejahtera, akhlak yang mantap, how you want to communicate with your colleague, how you want to communicate with your nurses, with your patient. Tu semua menguji kesabaran lah. Menjaga masa, okay? Be punctual, be before time. Kalau orang minta, yelah you must be there lah. Kalau you know that your MO kan around pukul 7:30, make sure bukanlah pukul 7 tu baru terkedik-kedik nak round. Mungkin you kena round earlier. Sebab you know that you aware that your punya MO akan round awal. So, takkan you tak tahu case langsung kan. So you kena come early so you are prepared. Your solat, jaga, somehow difficult, especially bila banyak patient. Okay, so tapi you kena jaga masa lah nak semayang. Takkan tak mau sangat sedih lah kan kalau terlepas waktu semayang kan, benda yang kita boleh. I cakap macam ni, korang rasa macam teruknya terlepas waktu semayang. Tapi in reality, benda tu boleh berlaku Especially bila busy. Kalau you memang really busy, attending a collapse patient, lepas maghrib, tu semua tu bolehlah dimaafkan sebab dia memang the entire maghrib. Tapi berdosalah kot. Kalau you dah ada masa sebelum tu, tapi you lambatkan, you tak sempat, tu something yang you need to ponder lah. You akan rasa macam waktu I as a student, waktu dengar orang cakap, orang pesan, jaga semayang waktu houseman, I macam, kenapa orang pesan jaga semayang waktu houseman? Macam something yang takkan tinggal kot. Tapi in reality, bila you busy, you kena aware of your time lah. Kena susun you punya masa. Okay? Dia tersusun dalam urusan. Susun you punya masa lah. Have a job list, apa benda nak buat, apa benda tak nak buat. And then sihat tubuh badan. So you kena be fit lah. You busy macam mana pun, spend time to exercise. It will help with your mental health pun. Okay? So, melawan hawa nafsu, of course lah. You kena jaga diri you, bermanfaat pada orang lain. Niatkanlah yang kita jumpa patient, kita cakap dengan patient. Everything is part of kita punya amal ibadah. Okay? Kalau patient faham, patient rasa seronok dengan kita, we change the patient punya life, tu pun ialah ibadah lah. Okay? Luas pengetahuan. Kena study seumur lah. Kalau kita manage patient blindly, tak tahu apa-apa, kesian dekat patient kita. Of course lah, kita kena offer the best that we can to our patient lah. Okay? So, anything else ni? Ada any question? Dah lama dah bercakap ni. Apa ni? Any question that you want to ask?
Ada orang nak tanya.
Tanya. Buka je mic, nak tanya pun boleh, nak in-call message pun boleh, ada off my apa tu?
Tak apa, ya.
So, kita tanya dulu.
Okay, so boleh dengar tak?
Dengar.
Okay, so this is more of like the human element of the medical field. How are you able to manage your time with, let's say by that time you get married and everything? How are you able to manage your time between family and work?
So a disclaimer, I'm not married yet. Tapi how I see my friend manage their time, basically to you must have an understanding partner to really understand how you work, and you must tell them how actually you punya work. Most of the time, kalau you janji nak balik pukul 5, it won't be 5 o'clock. Only 10% of the time will be 5 o'clock. It will extend to 6, 6:37, suddenly orang collapse. A lot of things will be. So you need to, especially if your partner is not a medical personnel, then you need to tell them the reality of your work. Okay? And even kalau bukan your partner pun, your family members, you need to tell them lah. And then how to, actually you must be, kalau I tengok my friends, most of them make the most of everything. Kalau waktu cuti, waktu off day, really keluar and spend the time at that point. Waktu post night off, really spend the time, jumpa dengan dia punya family. Bukan, maksudnya macam you need, the time yang you kerja betul-betul. The time yang you ada masa free, you masa free betul-betul. Macam tu. And then you plan your life lah. Will be a lot of pengorbanan, and trust me, when you masuk this medical fraternity, it really means that you bersedia untuk berkorban. Especially when you become kalau you want the journey nak menjadi a specialist, nak train dekat hospital. I've seen my specialist anak 5-6 orang, as they do their subspecialty, they tinggal jauh PJJ, husband and wife. As they become specialists, they get new placement. They PJJ with their life, with their wife, with their husband. So a lot of pengorbanan, and a lot of person kena berkorban lah. And it's not easy to lahirkan seorang specialist. It's lagi tak easy nak lahirkan a subspecialist lah. So semua orang tu susah. Okay. Going to the chat box, nanti kalau punya tanya je lah. Most unforgettable experience, moment during your HO journey. Waktu I housemate, to be frank, bullying ni ada dekat mana-mana je. There are some of even your specialists, ada pun perangai pelik-pelik pun ada. Ni I just sharing dalam bahasa Melayu sambil-sambil lah. Perangai pelik-pelik pun ada. Pelik-pelik lah perangai tu, dia mengajar tapi dalam keadaan yang sangat pelik pun ada jugalah. So ada yang macam demand you untuk pakai baju certain colour lah, untuk make up lah, untuk macam-macam benda pelik ada. Tapi so waktu one of the posting lah, so my specialist waktu tu macam dia memang pelik lah. So dia emphasize lah, suruh make up, suruh macam pakai macam ni, pakai macam tu. Tapi at that point I rasa macam I tak nak ikut apa yang dia cakap. So I try to macam present the case properly, tahu the case, discuss with him. Although dia macam like still peri-peri, still demand macam suruh pakai macam ni dia nak, suruh make up semua, tapi at the end dia kata, yalah, dia kata kat I macam, I understand yang you tak nak, tapi you've done good lah, macam you've done your best macam during the posting. Something macam tu, susah nak cakap. So kalau I cakap nanti dia kira pengalaman tu macam susah nak cerita, so personal, kalau orang tahu susah, orang tahu siapa macam payah pula kan. Tapi one of the best moment juga waktu I habis, the thing yang buat I masuk ONG ni, I habis my posting, then my specialist really panggil and katalah macam offer me to do ONG, direct me to the macam all this clinical waktu I start housemate, I tak tahu pun all this parallel pathway apa. Tapi he taught me a lot, and I think that is antara the best moment jugalah waktu I housemate. Moment yang teruk-teruk pun ada juga, hampir-hampir nak kena extend lah apalah, tu semua tu ada. Semua orang akan ada cerita dia sendiri. Kalau you nak become a medical lecturer, we need to take exam. If we want to be a medical lecturer, we need to take exams after we become a specialist. Okay, basically kalau you nak jadi lecturer, ada a few ways. So the first way is you boleh je study jadi specialist dulu dekat KKM punya setting, then you apply masuk Kementerian Pengajian Tinggi. That is the first way. So you nak jadi specialist ni is either bolehlah you nak ambil entrance exam, then masuk master, then you become specialist, or you nak join all this parallel pathway punya program, then at the end point you become a specialist. So this is the first way. The second way is you can join university first, either as a medical officer or a trainee lecturer. Then contohnya you join UIA. So UIA will then sponsor you or groom you to become a specialist via KPT punya cara. Meaning that katakanlah you join SASMAC as a trainee lecturer, so automatically you join katakanlah UIA punya master program, then after 4 years you become a specialist. Okay? That is the other way you nak jadi lecturer and specialist lah. So after you habis jadi specialist, kalau you nak jadi lecturer, you are required untuk ambil subspecialty juga. So for example like kalau macam ONG, there are few subspecialty. You have maternal fetal medicine macam Prof. Hamizah, you have urogynae macam Prof. Zalina, and then you have reproductive, now tak sure siapa. So you have all these subspecialty. So subspecialty ni requires another training for 3 to 4 years to become before you nak jadi a subspecialist. So the journey tu memang a long journey. So kalau you nak jadi lecturer, kalau you nak jadi clinical lecturer macam tu. Kalau you nak jadi a basic medical sciences punya lecturer, then after you habis punya housemanship, you apply lah. You apply ambil master in anatomy ke, master in pathology ke, then you go buat PhD. Kalau you nak jadi medical, kalau you nak ambil jadi specialist clinical, maksudnya jadi ONG specialist ke, you nak jadi PIT specialist ke, you ambil the specialty program for 4 years, you grad as a PhD punya ni. You grad dengan 3 line. So PhD lah, macam PhD holder lah. Tapi kalau you ambil master basic medical sciences, then you kena ambil master, then you kena ambil PhD. So master you grad as master, PhD you grad as PhD holder lah. So that is a big differences lah. Tapi you have a lot of time to think, so you boleh fikir. Yang penting complete. Waktu I dulu nak jadi BMS lecturer, so my Prof siapa Prof Azarisman kot, ke the wife tu, tengoklah. Cakap kat I, tak apa-apa pun complete punya housemanship. Then you nak come back, then you come back. So complete punya housemanship lah, that is the take home message. So ada apa-apa lagi nak tanya ke? Dah 11.56 dah pun.
Ada question from WhatsApp lah. Which one is better, working in private clinic or in a hospital, government hospital?
It depends on what you want actually. Okay? Kan macam my slide tadi, sampai je. So macam ni lah, you kena fikir what you want in your life. Okay. Ada orang dia nak jadi a clinical specialist. So kalau you nak jadi a clinical specialist, you nak jadi internal medicine specialist, you nak jadi surgeon, you nak jadi neurosurgeon, ped surgeon, you nak jadi ENT, all this, then you punya training must be in KKM punya hospital before you nak jadi specialist and before you nak pergi ke private. So that you must be clear. Kalau you memang nak jadi clinical specialist, you tak bolehlah keluar awal before you complete you punya specialist punya training. Sebab kalau you keluar awal, you tak ada tempat nak gazette, you tak ada training, a proper training pun. You takkanlah pergi ke private hospital mengharapkan a trainee nak operate on you. Orang belajar buat operation on you dekat private center. That will not happen. So, you tak boleh lah. Kalau you nak jadi clinical specialist, you tak boleh exit KKM tu awal sangat. So, after you complete you punya housemanship punya gazettement, you dah dapat that you are a gazetted specialist, then you nak keluar, you bolehlah consider nak keluar. Tapi kalau you rasa, aku tak nak jadi specialist ni, aku cukup lah, aku memang happy jadi GP ni, jadi macam doktor kat ni, aku memang tak plan pun nak sambung. I'm happy with my life. Okay, yes, then you can join the private sector lah, join the GP, you join GP semua, you belajar, you are still a doctor and you are still contributing to the ummah, and at the end, it depends on apa yang you nak dalam you punya life lah. Ada setengah orang, dia memang tak fikir pun nak jadi specialist. And it's okay. Ada orang memang nak pursue ni. It's okay. So it depends on apa yang you nak. Must bincang dengan you punya ni lah, you punya family member. Sebab kalau you join, you buat benda atas kerelaan, bukan kerelaan you, trust me tak akan tahan lah. Sangat penat lah. Being a clinician sangat penat. Macam now, macam now, on call is what, 7 times per week, 6 times per week. You datang kerja hari ni, you on call, so 24 hours. Esok tu you balik at 4:30 PM juga, petang juga. You tengok patient macam orang biasa juga. So sangat penat. So kalau you tak ada kerelaan hati, you tak minat pun, then it will be challenging and difficult lah. Tapi untuk housemanship tak ada pilihan, kena habiskan. So soalan lagi ke WhatsApp ke, kat YouTube ke, apa-apa yang you nak tanya?
Ada.
I think ada.
Is it true yang salary HO lagi tinggi daripada doktor kontrak?
Oh, salary HO. Okay, actually macam ni. Salary HO, dia ada allowance critical. So, allowance critical ni, dia macam ni. You do kerja government, you punya salary gaji pokok satu hal. Lepas tu, dia banyak allowance lain lah. So, allowance critical lah, allowance, macam allowance lah. So, kalau you kerja Sabah Sarawak, you ada added allowance lah. So, banyak allowance dia. So kalau you UD 41 as a houseman and UD 41 as a medical officer, the pay tu different. Sebab waktu you houseman, you ada allowance critical sebanyak 600 ke 900 lah. So you ada allowance critical. Kalau you lepas tu you join KK, you tak ada on call, you tak ada on call lah basically. Tapi now you jadi contract UD 41, you dah tak ada allowance critical. So bila you put side to side, you punya total gaji as a medical officer yang tak ada on call, you punya gaji akan lagi rendah daripada medical officer, daripada house officer. So house officer ada allowance critical yang reward diorang kerja night shift. Okay. So kalau lah you as a medical officer yang ada on call, so you ada sila elang, nama dia elang flexi. So kalau lah you ada medical officer yang ada on call, you tak terasa sangat you gaji lagi kecil lah houseman. Sebab you ada on call claim. Macam itulah. So that is the kenapa orang bising-bising pasal gaji MO lagi kecil daripada gaji houseman lah. So kalau gaji MO yang buat on call dia tak terasa sangat. So per month dia ada on call yang banyak yang kerja penat tu. Tapi you dapatlah about 1.5k per month from you punya on call. On call, kalau you fikir kan, you kerja 24 hours, you hanya dibayar RM220 untuk 24 jam you kerja. Tu you punya allowance tambahan. So macam tu lah. So kalau 2 kali you on call weekend, 24 jam tu you dapatlah RM440. So plus minus dia begitulah. Okay? Apa lagi you guys nak tanya? Dia tanya macam mana nak dapat kontrak, tak kontrak, tu aku tak tahu nak jawab macam mana. Sebab now the first batch yang diorang nak serap from kontrak nak jadi a permanent officer, yang from the interview hari tu, they interview about 6k plus, I rasa yang diserapkan about, tak sure berapa banyak. Tak sure berapa banyak yang diorang serap. The criteria pun actually tak sure apa kriteria dia, sebab some of my friend even dah buat parallel pathway, dah ambil specialist exam, semua pun tak dapat offer permanent. Tapi what I can advise is at least kita try lah. At least kita try. And those yang tak dapat the permanent tu, they still offer contract lah for now. Okay, apa lagi you guys nak tahu? Dah pukul 12 lah.
Kak Lina, I have a question. Your work area related to human, right? So our condition is depends on you. So don't you feel scared or
Sorry?
Your work area related to human, right? So our condition depends on you. So don't you feel scared?
Okay, you macam ni. Memang dia memang kita memang kerja kita ni melibatkan manusia, melibatkan nyawa manusia semua. You just fikir macam ni lah. We give the very best that we can, and at least we try our best. Some mistake will happen along the way, but we try our best. That's why we need to continuously learn so that kita give the best that we can offer to our patient. Okay? So kalau and then macam sama jugalah. So you know that kita punya working ni semua involve manusia kan. So you must make sure that you taklah jadi pembuli pada houseman. You treat your punya nurses well. Walaupun menguji kesabaran, you pun rasa nak marah. Tapi you kena bersabarlah, teruskan bersabar. Macam itulah. Tapi regarding error in managing patient, error do happen. That's why kalau now you are in training, then you have, now kalau you houseman, you have your MO nak counter check, you have your specialist nak counter check. We are in the system yang macam tu. Regardless, error do happen. And kita, my kawan sampai sekarang pesan lah, hari-hari memang semayang, memang doa kan, so that kita tak salah manage our patient lah. Macam tu. So, few doctors during locum, private clinic, hospital, is it okay? If it is okay, do they start during HO, MOA adik-adikku? HO tak boleh buat locum sebab HO you tak dapat lagi nombor APC, you tak dapat MMC penuh, you dapat MMC sementara. Sebab tu kalau jadi houseman je, you tak boleh kerja dekat klinik GP as a medical officer. Jadi pembantu klinik boleh, tukang ambil darah boleh, tapi you tak boleh buat locum as a HO sebab you tak ada nombor MMC pendaftaran penuh. So kalau you nak buat waktu you punya MO, tapi pesanan penaja, janganlah sampai dia effect kau punya kerja. Janganlah kau buat locum tu sampai kau tak pergi kerja, sampai kau kerja macam hampir sebab penat buat locum kat tempat lain. Itu pesanan penaja lah. Sebab kena ingat kerja utama tu yang kita kerja dengan kerja asal tu, KKM punya kerja tu, locum tu semua tu rezeki tambahan lah. Boleh nak buat, boleh, tak ada masalah. Tapi make sure dia macam tu lah. Kau janganlah locum time hari kerja, kau EL hang buat locum, semua tu berdosa lah sebenarnya. Okay? Regarding on calls, how many passive and active on calls do surgeons face? Itu depends on berapa banyak orang dekat kau punya department. Contohnya now, kalau dekat ONG dekat sekarang ni, punya on call will be about 6 to 7 active call, and then passive about 2 passive call lah. So lebih kurang tu sebenarnya, kalau kita fikir on call 6-7 kali tu, fikir macam ni je, 6 hari on call, campur esoknya tu dah jadi sayur sebab post call, so dah jadi 12 kali dah hang macam sayur lah. So sebenarnya 12 hari you punya family hilang you. Sebab you rasa, kalau especially as MO lah, kalau houseman night shift tak apa sebab dia shift kan. Tapi kalau waktu you MO, you buat your 24 hours call tu, balik esok tu memang you sayur lah. So sebenar-benarnya you hilang daripada family tu kali 2. Kalau you on call 6 kali aktif, 12 kali lah sebenarnya you hilang daripada your family. That is the bitter truth lah. Okay? So ada apa-apa nak tanya lagi ke? Puan? Tak apa, benda-benda ni hampa akan lalui, jangan risau. Dan insyaAllah ramai orang lalui, ramai orang berjaya, insyaAllah korang pun boleh berjaya lah. Okay? So any question? 12 tengah hari lah. Okay lah, tengah-tengah hari ni korang boleh hidup dan mendengar talk. Itu sangat amazing.
Okay, dia orang
apa nak tanya?
Dah selesai end dah.
Itulah. Sebab apa memang dah end dah pun.
Okay.
Baik.
So, thank you so much. Thank you so much for this sharing session, Doctor. Now, ladies. Okay. So this session is about to end. Dear participant, if you want to rewatch the program, you can find it on our YouTube channel as SITCIIUM. So this session has been so informative, and we really hope that you guys enjoy it. Okay. So if you guys enjoyed today's session, please type any emoji in the comment section. Emoji pun dah letak ni. Okay, tak apalah. Okay, so now we are going to the photography session. Okay, so the photographer, siapa? Boleh get start?
Saya ambil. Okay, ready. Ada lagi tak yang nak buka kamera? Satu, dua, tiga. Okay, lagi. Satu, dua, tiga. Dia nak buat peace ke?
Ya, wait. Kalina boleh stop reason kot. Besar sikit gambar. Alright, thank you. Okay.
Okay. Satu. Okay, ada lagi tak nak buka kamera? Okay, satu, dua, tiga. Peace. Okay. Okay, dah.
Okay, everyone. So we are now at the end of our session. On behalf of the organizing committee, I'd like to apologize for any shortcomings that has been occurring. And it has been such an honor to be here with you guys. We hope to see you again next time. So I would like to thank everyone again for coming and making this program a success. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Have a very good day. Bye-bye.
Thank you.
Thank you, Kalina. Thank you semua.
Thank you, Kalina. Thank you semua.
Alright. Thank you, everyone. Alright, thank you, everyone. For those participants, you can leave the meeting. But for committee, please stay a while for the postmortem meeting. Okay, thank you.